Hi, baby.
All right, girlfriend.
Oh, hi, baby.
Down a little bit. Look at all that hair.
Yeah, absolutely. I always get asked, or if I say I'm a doula, they'll say, "Oh, like a midwife," which is it is very, very different. We have incredible midwives in Indiana, and they are very well trained, more than me, I promise. And so a doula does have to go through a certification. So we are knowledgeable. Mine was meant to be about 4 months long online because it was 2021. All of the 2021. So we're always working to learn and be knowledgeable. But we are there. I run around with a lot of different terms in terms of comparing doulas, but I think for first time moms, I like to talk about them as sort of your wedding planner. So many of us turn to a wedding planner to help us with that big day because they have the experience. They have experience, they have connections, they have knowledge, and they're going to walk you through with all of that in their bag. And that's exactly what a doula does for your pregnancy. They're there from you from the beginning, knowing what you want for that end result for your wedding day or your birth, and doing everything we can to make sure that you can achieve that, from building a birth plan or birth preferences to working on pain management for the birth, pain management during your pregnancy. I get partners very involved. Fathers are not off the hook in this situation. If they're there, partners are involved. And so that's a lot of how I like to describe it, because I think we can relate with that a little bit more.
Yes, yes. So when do you typically need to find a doula in your pregnancy? When does this relationship start?
I would say the sooner the better, just in terms of, like you said, building a relationship. I think the doula you choose should feel like someone you can be friends with. Like if you sit down like you and I are, and you don't end that conversation thinking like, "Ooh, I kind of like her," like, then she's not your doula. Like, because you need to be so picky about who is in your birth space. Like, that is a sacred thing. So the sooner we can build that relationship, the better. Having said that, if you are 37 weeks pregnant right now, listening to this and dealing with a lot of anxiety and fear, and maybe thinking like, holy moly, I don't know what I'm about to do. It is never too late to hire a doula and get to work, and if that happens with my clients, sometimes we're going to meet much closer together and be a little bit more intense about it, where if it's over the whole pregnancy, we kind of spread them out.
For sure, for sure. What are some examples of, situations where a doula will maybe kind of help step in during your, either pregnancy or even really during your delivery?
Yeah, during labor, I think is probably going to be that like heat of the moment. It's game time. It's kind of how I like to describe it. And I actually do like to describe labor and birth as sort of this big athletic event, for lack of a better term. I think it is not necessarily a medical emergency. This is an endurance thing. So that's one way I try to dispel some fear, is a lot of us girls can relate. Hey, what sport did you play? What did you do? What was the hardest thing about that? I have a mom right now who, she was like, yeah, I was a rower. And I was like, you are a rower? Like, that is so badass. Tell me about this, And so she was telling me about rowing and what were the hardest parts in these sprints that are like 7 minutes long. And I was like, girl, your sprints are going to be 1 minute long. Like, that's it, And so I'm not trying to downplay it. It's going to be the hardest event of your life. But if you can compare it or prepare in your head a little bit more like this athletic event, this endurance I'm going to have to go through, it's a little less scary. I think during labor, I'm there mostly to be hands-on, and it can either be me or their partner. Really, when it comes to hands-on, doing counter pressure on your hips or on your sacrum or playing with your hair, I would really much rather that be the partner being there, because that is going to bring off all those good hormones and make mom feel good and relax and baby come. And that is a real thing. Like, sometimes I will say, Dad, you need to get in, or partner, you need to get in bed with your partner. We're going to leave and go get something to eat. Why don't you guys just snuggle for a little while? And so we're making those suggestions constantly. Movement is big. I'm probably going to make my client move more than she wants to, whether it's in the bed with an epidural or up. So, all of those things, your doula should be able to navigate whatever your labor situation is and be able to, assist baby in coming down the birth canal in a good position and your dilation to occur, help you with pain management, and then just continually be encouraging you, getting you drinks of water. Heating pads, cold washcloths, kind of everything. And I toil with home births and hospital births, but I think in a hospital birth, especially, doulas are so useful just to be a barrier between the staff and the patient if needed, but also be a helping hand. I can't tell you how often I say to the nurse, like, no, I can get her a heating pad. You go chart. I got this, And so it really just makes, I think, the whole situation a little bit better. Yeah, because let's be honest, what we picture for our experience is often not how it plays out. And so I do like to talk through a lot of scenarios with the couple. I think manifestation and thinking about things can really help. And so specifically in a VBAC situation, I'll say like 9 times out of 10, I want you to picture having that vaginal birth you want. But 1 time out of 10, I need you to experience in your mind what it's going to be like if we end up in the C-section room. Like, I need you to do that. And so, but if we're in the heat of the moment, and I tell my clients this, whether they are religious or not, and if you are pregnant and you want to use this, it's a good one. If you feel like you need a minute from the doctor, from the staff to make a decision, to talk, to call someone, whatever it is, just say, you know what? Can we pray about this for a minute? Everybody's out. I don't care if you're religious or not. If you kind of are one of those people that it's like uncomfortable, you don't want to, be a jerk, you don't want to come off that way, which as women, we are constantly thinking, just say, can me and my husband or me and my partner, whoever's there with you, me and my mom, can we pray about this for a minute? And then we can kind of have the moment to just, hey, let's talk about our options. Yeah. And the acronym that we like to use is BRAIN. So it's benefits, risks, alternatives, what your gut is telling you, intuition. And then the N is nothing. What if we just do nothing right now? Right. And so we'll go through those things and talk about benefits and risks. I am never making the decision for the client, ever. And I really try not to be the one who speaks up to the doctors either. So we might have our discussion and then we know what mom wants. Partner needs to know what mom wants. Partner is the first one to say, hey, doc, I don't know if you're quite hearing what she's saying. I've already prepared that person for that role. If I am very last line of defense. And that is because, one, I want to empower the couple. I don't want to speak for them. And I don't want there to be an ounce of negative energy in that room because of me. Like, that's not why I'm there at all. I don't want, and that's not a self-conscious thing. It's that I know that's going to negatively impact my client. So yes, I want to be kind to the doctors and nurses and helpful, but the main thing is that we need to have a very peaceful, calm environment for our client, even if we're dealing with some maybe unknowns. Mm-hmm. Mm-hmm, absolutely. And I'm so happy you brought that up. I have a client that I just spoke to and she's close to her due date and her dad passed away in February. So she is really struggling right now as she's dealing with nearing that 1-year mark, but also, we get this, right? She's bringing her first baby into the world. Dad's not going to be there. And she watched her dad pass away in a hospital. And she said, I don't want to go to the hospital and put the same gown on that I watched him pass away in, right? And so whether it's just an anxiety thing or maybe some things from your past trauma that might revolve around hospitals, there are a lot of options, especially in the labor and delivery unit. So we can, of course, ask for the lights to be dim all of the time and to go off more natural light. You can bring fairy lights. You can bring encouraging, like sayings to put up on the walls, pictures of your other children or family and friends, and then music and things to watch and games. Like, you are going to be there for a while. If we're not passing time, it's going to be hard. So yeah. Environment is actually the very first thing on my birth preferences sheet is let's talk about this room and how you feel about it. And honestly, there are some people who don't feel uncomfortable in a hospital room. They haven't had anything to make them feel that way. And it's like, oh, none of it bothers me. Hey, that's great. It doesn't need to bother you. Like if you're comfortable and you don't want to bring a bunch of stuff, that's fine. But if you think this might help you feel less anxious or more encouraged, or just maybe you desire more of that birth center, home birth feel, but you want to be in a hospital, you make that space your own. It's yours. I would just say to really evaluate if you're ready to advocate for yourself. I think many of us are. And you might feel like, this has inspired me to inform myself, but I think I can advocate for myself on my own, and that's okay. But if you have trouble advocating for yourself, if even the thought of that makes you nervous, if you're dealing with fear, I think a doula is a great option for you. I think I don't know if I've ever heard someone say that they regretted having a doula. And I mean, it's easy to throw out stats. It's easy to throw out stats that, 50% reduction in C-section, 25% shorter labor, and all of those things. But I think what it comes down to is having a really supportive, loving team around you through this incredible experience of life, and feeling like you were empowered and supported and loved through that, not brushed to the side, not just a number, not those things. So as women, we are such people pleasers. We are, whether we want to believe it or not. We are taught to say thank you and that it tastes good and all of these things, no matter what. When you are in labor, do not be polite. It is you. It is all about, I always say that. I'm like, if I am touching you in a way you don't like, just tell me. Like, be like, stop touching me. Like, don't feel bad. It's not about my feelings.
I love that. That's awesome. And it kind of made me think of one thing too. I don't know if this question comes up, but what if a mom is, would I offend my OB if I have a doula in the room?
Mm-hmm. Yeah. Yeah, absolutely. Talk to your OB if you're wondering about that. I find most OBs to be very supportive of doulas, especially when they're fulfilling the role they're meant to fulfill. Right. And so I think that they know the benefits. More and more, we're seeing doctors kind of happy to see us there, which is great. I know for me, I want doctors to leave feeling like, I'm glad she was here, not the other way around. Also, you can ask your doctor for recommendations. You haven't worked with a doula before. Maybe your doctor knows a great doula who's close to that hospital. So I would say, one, talk to your doctor. Absolutely. And never interview just one doula. I would say interview more than one. In general, we are all very supportive. I always tell people, if I'm not your person, that is totally fine. I want you to pick your person. And so definitely try to find a couple to interview. Look for people that, again, a friend. You want someone who feels like a friend that you can trust from the very beginning. But I do want to throw out, because another phase of life that can be really challenging is that fourth trimester. And we do have incredible postpartum doulas in Indianapolis and Indiana. I don't do postpartum. My focus is birth. That's where I want to be. But there are so many postpartum doulas that will do overnight work for you, help you overnight, help you during the day, do laundry, dishes. And these are women who really just love supporting you through this time where you should be holding your baby and only worried about your baby. Let us come help. And so if that is much more of a stressor to you than maybe what we're talking about today, those resources are available. So don't be embarrassed about that. We're all doing this as a village, kind of going back to our roots as women, back when we all gathered around each other for childbirth. I think we're inching back towards that. All in all, we'll kind of go back to that wedding planner, right? It's a lot. So to arm yourself with a couple little helpers along the way isn't silly. You know, we all need support.